Look at your health. So now we shall be talking to Dr. Naveen Chandra Acharya, sorry for butchering your name, who's going to help us. He is a urologist. So we're going to talk about the condition of prostate cancer. It's a very it's a condition that is very much with us, particularly in a certain age group. And I'd just like to shed light on it and figure out what the treatment options are, and perhaps how you can protect yourself by getting early checkups and treatments. So over to you, Dr. Acharya. Could you tell us what is the prevalence of prostate cancer as a urologist when you go about your business as a doctor? How often do you encounter it, and do you have some numbers that could shed light on the prevalence of prostate cancer in Kenya, Africa, even the world over?
Prostate cancer is the most common cancer in male population, and it actually it increases after the age of 50. And if you see the age standardized prevalence, it is around 40 in 1 lakh population. And as the age increases, the incidence of the cancer also increases.
Okay.
And most of the patients which come to us in urology are in advanced stages of prostate cancer.
What is that?
Advanced stage. They come in a very advanced stage, not in early stage.
Okay.
So right that time, our hands are really tied, and we don't have much to offer to the patients. So this area needs serious. It's of serious concern for us to detect early cancers and screen them and treat them early.
Absolutely.
Yeah.
So you've talked about an age group that is more vulnerable to it.
Yeah.
Could please expound on that? Perhaps someone is watching at home and they would like to know whether they fall within that bracket.
Yeah, the age group is usually after 50 years of age, and it is after 50. But in people who have prostate cancer in their family, it can be early also. So there is something called age anticipation phenomenon. If our father suffers from prostate cancer, the son can have prostate cancer few years earlier. So what I suggest is that all people who have history of cancer in the family should get themselves screened for prostate cancer at early age, probably at the age of 40. And other people who don't have prostate cancer incidence in the family, they can come at 50 for routine screening, even if they don't have symptoms.
Okay.
So you don't have to go to the urologist only when you have symptoms of urine problem, like passing urine frequently, burning urination, blood in the urine. All these are symptoms which may indicate cancer in your body. But in your family, if somebody is suffering from prostate cancer, it is better to go to the doctor, even if you don't have symptoms, at around 50. Earlier is better.
Absolutely. And that makes a lot of sense, because you have the same genetic makeup, and perhaps you're genetically predisposed to this condition. But at the same time, when you look, and with your experience in the Kenyan community, is that something that is preferred? Do you find a lot of people going out of their way to find a doctor and get checked? Because cancer is associated with a lot of negativity, death, you know, there's a lot of stigma surrounding it, people going to debt because, so a lot of people would rather not know. So what has your experience been in terms of people's attitude towards these early checkups?
In urban population, I have seen a trend of people going through the Google and going through all these social media.
Yes.
They are aware of prostate cancer and the treatment and the screening program, and they tend to come early. But in rural population, they are not at all aware of it.
Okay.
So if you see the data, 50% of the Kenyans are not aware of what is prostate cancer and what is the screening for it. So only 50% are aware. Out of those 50% also, most of the people dilly-dally into coming to a doctor. So probably 20%, I would say, are the people who come for a screening for the checkup of prostate cancer. 80% are they don't come usually.
And they don't come, or perhaps they
only present to a doctor when they have symptoms.
Which is quite unfortunate. As you said, as you mentioned earlier in passing, then sometimes that is at an advanced stage. Now let's talk about, perhaps to give hope to the people who are watching at home who might be in this age bracket, or perhaps have a history in their family of prostate cancer. Tell us about, first of all, the symptoms that, if in case they aren't going for those checkups, what are the symptoms they should be looking out for?
The irony of it's the fact that in early cancers, they are usually asymptomatic. There is a screening test called serum PSA, prostatic specific antigen test. It is a test which can detect cancers in early stage. So this is something which is very important, that every master health check or every screening test for a health checkup should include PSA after age of 50 if they don't have family history of cancer, and after age of 40 if they have family history of cancer. So early cancers may or may not have symptoms, but late cancers will have urinary symptoms, like they will pass blood in the urine, or they will have burning micturition, they will have difficulty in passing urine, they will get up frequently to pass urine, or if the cancer spreads in the surrounding organs, they can have bony pains, because the prostate cancer has affinity towards bone more. So back pain, leg pain, joint pains are very common if the cancer spreads. So, but that is a very late stage to treat. So the symptoms can be asymptomatic. It is very early. In that condition, only PSA test can indicate whether the patient has cancer or not, and then we have to go for a biopsy. And late cancers can be like blood in the urine and bone pains as per the stage of the cancer.
Okay, and I'm sure a lot of the viewers watching at home know, given also with corona now, are familiar with the term asymptomatic. It means you're showing no symptoms at all. And that wouldn't then that categorize this type of cancer as a silent killer?
That is a silent killer, but as the prostate grows, it will start showing its symptoms. But sometimes it is too late. But a cure can be offered only in early prostate cancer. So as per the data which is available in Kenya now, 20% of the patients qualify for early prostate cancer. So 80% of the patients they come very late. And what we have in our kitty is just to give hormones, some injections, or a chemotherapy. So that is a too late stage for us. So 20% only qualify for early stage and early prostate cancer, and we can offer the cure. In the Western population is the reverse. So 80% of the patients are screened and they come in early stage and they are offered cure. So we have to stress upon the screening test, early checkup. So the message to the masses is that don't wait for the symptoms to come. Don't wait for the symptoms of difficulty in urination to come. Just present early, get a yearly serum PSA test.
And you know, I've realized we might be, we perhaps are being presumptuous. We haven't mentioned that this is a cancer, if I'm not wrong, that affects men primarily. Yes, it's a thing that men.
Prostate is an organ which is present in the males.
And just to be clear.
It gives nourishment to the sperms, and it has a reproductive function. So it is a male organ. So it.
Absolutely. And given the sensitivity of the region that it actually affects, could you speak to perhaps the treatment options that are there? Because some people will be afraid that they will be destroyed. You know, these are some of the fears that would actually feed into people not going out of their way to seek those screenings. Talk to us about treatment. When it's earlier on, what are the options? And when it's at later on stages, what are the options? And what hopes are there in terms of percentages of a person living a normal life after diagnosis?
Prostate cancer is basically a cancer which is manipulated by the male sexual hormones. So male sexual hormone has a lot of effect on the growth of prostate cancer. So whole treatment is around hormonal manipulation. But early cancer can be removed by eradication of the tumor from the body along with the prostate. So what we have is a laparoscopic radical prostatectomy, where we remove whole prostate gland around surrounding fascia. Everything is removed with one operation called laparoscopy, where small holes are done in the body. And this operation will go on for 2 to 3 hours. The patient will stay in the hospital for 2 days and 2 or 3 days. So there is minimal blood loss, and patient can get back to the work very quickly. But if the patient comes very late, then we have only hormones to offer. These hormones will definitely deplete the patient of male sexual hormones, and that male sexual hormones, if they are depleted, we call it as a medical castration. It's like removing the testes. So if these hormones are given to deplete the male sexual hormones, then that will contain or curb the growth of the cancer in the body. So it is basically suppression, not the cure. And if the hormones will, even if you start hormones in late cancers, these will work for a period of 4 to 5 years, and then they will stop working, because the cancer will find its own way to counter the hormones.
Okay.
And that is some genetical changes which happen in the cancer. In that time, we have to go for chemotherapy and radiotherapy, which can make the patient's life miserable.
Okay.
So it is our aim, or all health workers should aim for emphasizing on the early
checkups,
prostate
yes.
cancer and screening, because we don't want patient to go through hormones, because that basically quality of life is very important.
Yes.
And suppose hormones are being delivered to the patient and his sexual life is gone, the most of the patient will feel miserable in their
remaining years.
Yeah, because without any sexual potency and having cancer in the body, bone pains, it makes the patient's life miserable. So if you pass on this message to the people that come early for detection, don't wait for the symptoms, so that we can cure the patient with laparoscopy. And the surgery is really not a very big and catastrophic surgery. It is a 2 or 3 hours surgery, and patient can really get back to their normal life. They will have the preserved sexual potency. They will have the preserved urination also. There is a lot of misconception in the society that if you undergo the prostate surgery, they will lose the control of urination. They will have to wear diaper. That is a major deterrent why the people don't go for surgery. When I interact with the people, they say, if I undergo surgery, I lose control on my urination. I have to wear the diaper every time. So it's better I'll go for hormones. It's okay for me not to undergo the surgery. But with advancing medical technology, we can really offer a laparoscopy, and even the robotics have come into the picture, where we can control the nerves and control the erectile function and control the urinary, the sphincter also, that the patient will not lose control on the urination. So we have to emphasize on this, that you are not going to have a bad and worse life afterwards. You will have a good life. You will have control on urination also. You will not have to wear the diapers. So if you emphasize on these, patient will automatically get convinced and go for a surgery.
Treatment options have been advanced, but either way, early detection is key. Now, as we talk about that, these are treatment options that are available, but with a country that suffers when it comes to, early testing, when it comes to basic treatment options, basic healthcare, we're not very advanced when it comes to that. Could you tell us about the availability of these services in the country, whatever hospital, whether private or public hospitals? What is the state of that? Because we might be blaming the patients or the people for not going out of the way to find treatment, whereas where they're living, these are not things that are readily available to them.
Basically, we have certain problems in medical technology over here in Kenya, but see, there are things which we can go for. Even if we don't have access to the medical technology, you can go for open surgery. So it is really a task for the general practitioner to detect cancer and send a patient to the higher referral centers for open surgery. But laparoscopy is now coming in the big way in Kenya too. In our hospital where I work, we have a laparoscopic radical prostatectomy as available option for prostate cancers. I am sure the other hospital will also take up laparoscopy. Right now, laparoscopy for radical prostatectomy for prostate cancer is really in infancy in Kenya. I don't have any data statistically how many centers are doing it, but I am sure that it is a very few centers, or rarely somebody is doing it. And we are taking up this task at Medihill Center to do laparoscopy, and we have started it. So probably other people will also start it. It all depends upon somebody has to pick up this newest technology. If some hospital picks up, the other hospital also will pick up, and slowly it will gradually spread to all over the Kenya.
Again, we might be acting on presumption. Perhaps explain what a laparoscopy is as opposed to open surgery.
Laparoscopy is a technology where we have a camera which is inserted in the abdomen with a small hole. So it is a 5 to 10 mm hole in the abdomen, and we use other equipments with handheld equipment which are introduced from the other small holes in the abdomen. So we will have around 4 to 5 holes on the abdomen which are around 5 to 10 mm. We go inside with the camera, we see the prostate, and with other equipment we remove the prostate, which involves energy sources like harmonic or ultrasound energy. And and we remove the prostate in a bag called EndoCatch bag and remove the prostate. So these things are being used for other cancers in many hospitals. I've seen many hospitals in Kenya of using laparoscopy. But some advancement in this technology by using better harmonic, means ultrasonic energy sources, we can really go for a laparoscopic prostate cancer surgery in other centers also. So it needs a little bit of training to the doctors over here.
Yes.
And we can really hope for this technology to spread in Kenya. So it is nothing that a hospital has to acquire big thing to start this. They have to acquire smaller things like some energy sources, some training for the doctors. It might take a period of 6 months to 1 year, but it can definitely propagate this technology in Kenya to start the treatment for early prostate cancer.
Okay, and as we think about that, the options right now, what are they? Can we see, and can we hope for people to stop jetting out of the country or flying out of the country to get treatment?
See, the deep-rooted feeling in people of Kenya is that if they afford to go for a treatment, let us go out of Kenya. Let us go to countries where they offer laparoscopic surgery, because they have the misconception that this treatment is not being offered in Kenya. So, and they have some people, they have information that somebody has undergone surgery over here and he has lost control on the urination, and so such negative feedbacks are many. So we have to really the basic intention of coming on the television is to pass on the message that we have started this surgeries over here, and we are doing with equal result, and you don't have to fly out of India or fly out of Kenya for this treatment to any other countries like India. So we have started this treatment at our center, and probably the people can come here and see and watch whatever patients we have operated. They can see the result and get convinced, and we are sure that they will get convinced, and we can stop this trend of people going for medical tourism outside.
Yes, medical tourism is quite a big thing, of course. And now, last but not least, we talk about treatment options and it being better to get it identified earlier rather than later, because your chances of survival are higher. I'm sure there are people who are watching at home who are wondering, even before we get to the point of going for those checkups, when I get to a certain age, forget the genetical predisposition, tell us about what kind of lifestyles men should be living to ensure that they have a better chance when it comes to avoiding prostate cancer altogether.
Prostate cancer as such is a there are so many factors which causes prostate cancer in the body. Mainly there are genetics and there are hormonal factors also. We have seen that the African people are more prone to get prostate cancer. Probably the levels of sexual hormones are 15% more than the rest of the population in the world. So these are the things which we may not be able to alter. But there are some factors which are chemoprotective. The term we use is chemoprotective. Okay. This chemoprotective means there are some diets which are helpful in giving some protection for against prevention of against development of the cancer. Such as some studies have come forward where 7-day Adventist church people have less incidence of prostate cancer because they consume lot of tomatoes. So we have found out there is a substance called lycopene in tomato peels, and lycopene tablets have been given which has lot of antioxidants which helps in development of immunity towards prostate cancer. There are also reports of soya milk or soya products being very chemoprotective against prostate cancer. So these are the few drugs which are few things which are effective against prostate cancer because of the hormones and which are the antioxidants which are there in the food and vegetables. So what I would advise that every patient who has a family history of prostate cancer should really go for a diet which is full of antioxidants. The vegetables, fruits are full of antioxidants, so they should rely on eating more of vegetables and fruits, especially soya products, soya milk, and lycopene tablets. They can take supplements because the people now take over-the-counter supplements of vitamins. So
Yes.
taking lycopene is very simple. You can go to the counter and take lycopene. This can really boost the immunity against prostate cancer. To what extent it will prevent people from developing prostate cancer is not known, but definitely it will give some immunity to people.
Yeah.
So going for a healthy diet, exercise is very important. The fats are really bad for any cancer because they contain a lot of hormones, and these things are not going to help the patient as far as immunity is concerned. So having a very healthy diet, healthy lifestyle can protect you from prostate cancer, not only prostate cancer, but many other cancers in the body.
Absolutely, a great diet, exercise, avoiding being overweight, and so many other things that you could do even before you get to the point that you need to go for a checkup and find out whether or not you have prostate cancer. But indeed, you need to learn earlier rather than later. Thank you so much, Dr. Naveen Acharya. He is a Medihealth Hospital from Medihealth Hospitals Consultants. He is a urologist. Remember, you need to get yourself checked in order to know whether you have a prostate cancer or not. Earlier, the better. And of course, that heightens your chances of surviving this type of cancer. Thank you so much, Dr. And we're going to take a short break. When we come back, we'll continue on with your health. Stay tuned to Morning Express.